you've been with FreshSkin now for the...
I've been with FreshSkin for about a year.
Okay.
I do what, the alternative medicine or integrative medicine portion of the practice.
Okay.
I basically see everything related to age-related disease, whether it's weight loss or weight management, per se, inflammatory disease, micronutrient deficiencies, menopause, andropause, sleep disorders, fatigue, you name it.
Okay.
Pain relief for sure. My doctorate is in Oriental medicine.
Okay.
I'm board certified in integrative medicine and anti-aging medicine. So I focus a little bit more on what I would call the gray area of integrative, where I use acupuncture in a clinical setting, but I try to use it in more of a Western medical arrangement. Instead of focusing a lot on the Eastern theory of qi and blood and all of the the energetic response, I focus a lot more on the evidence and the research out there to make sure I elicit a true response and heal the body.
And do you have a lot of people that come to you and they don't really know what the problem is, and then you help dissect it for them?
Yeah, the best way I can explain it is we are together, collectively, we're kind of the first or last resort. So there are people who have they're afraid of doing a whole lot of things and they want a real educational and researched approach and want to learn what's going on with me, how do I fix it, what's the best course of action. Or we get the other spectrum where they've tried everything.
Okay.
They've tried every fad diet on the market, they've seen every different physician, they kind of feel like they're getting bad health care or pushed out the door, just kind of a number in the system, and we'll take the time and spend the hours or the days or whatever is necessary in order to figure out what's going on and create a true plan to get them the result they're looking for.
And this is really kind of, we can't see the whole office right now here, but this is really kind of like a spa environment. I don't feel like I'm in a doctor's office per se here, and it has just a different feel, and it seems much more relaxed. And
we are definitely a more relaxed, even and sometimes party-like atmosphere. We're definitely not this clinical get in, get out kind of office visit. Dr. Josie and I both typically spend anywhere from 30 minutes to 90 minutes with each of our patients. So, if we see 10, 12 people in a day, it's a busy day. We're definitely not the every 10, 15 minute visit, patient kind of people. We view healthcare as kind of a partnership between the patient and the provider and an extension of the practice. So, we make sure that people, get what they're looking for and are happy to refer their friends and family.
Okay. And you're truly like an educator.
Most of the time
in this process, aren't you?
Yeah, most of the time it's education. I mean, of course, we want them to, do what we suggest in order to get better, but we want them to understand what they're doing, so if they have to explain it to their primary care physician or their specialist or their friends and family who are also worried about them and care for them, that they have an understanding of what they're doing and why they're doing it.
Okay. And do you often work in conjunction with someone's primary care?
Yes.
Okay.
What's one of the good things, like I said earlier, about working in that fine line of integrative medicine is that I have the Western vocabulary to work with their Western physicians, and am not against them using medication. A lot of times they need this medication. Sure. We just do our best to make sure that they get all the rest of the health care that's necessary in order to resolve the problem and not just mask it. And Dr. Josie's background in family medicine and all of her contacts work well with referrals where they're stuck, where those physicians are stuck, and they say, I know a practice that can look at things a little bit differently, and they'll refer over to us.